Hello guys, this is just a quick video note of the guidelines on the investigations that need to be done for children with UTI. So just a second. I'm so sorry. Alright. So what we need to understand are the definitions. The first thing is an uncomplicated or a typical UTI. Typical UTI would be any UTI that is caused by an E. coli organism. Different serotypes of E. coli could be the cause, but anyways, it is caused by E. coli in a child with this UTI responding well to antibiotics after within 48 hours of treatment. Okay, that is an uncomplicated or a typical UTI. An atypical UTI would be, of course, the UTI which is not caused by an E. coli organism. So an UTI caused by something else, if it does not respond to antibiotics, if it is associated with a systemically unwell child, if the child is septicemic, if the child has poor urinary flow, and if the UTI is associated with bladder or lower abdominal mass, then this should be considered as atypical UTI. Now, what is recurrent UTI? Now, to say recurrent UTI, what we need to understand is what is an upper urinary tract infection and lower urinary tract infection. So an upper urinary tract infection would mean pyelonephritis, and a lower urinary tract infection would mean either cystitis or urethritis or a combination of both. All right, so pyelonephritis means infection of the kidneys and the renal pelvis. Okay, now to define recurrent UTI, if this child has more than 2 episodes of upper urinary tract infection or 1 episode of upper urinary tract infection plus more than 1 episode of lower urinary tract infection, this patient is said to have recurrent UTI. And if this child has more than 3 episodes of just lower urinary tract infection, again this child is said to have recurrent UTI. Now, what we need to understand is that there are few investigations that need to be done. An abdominal ultrasound during infection, an abdominal ultrasound within 6 weeks of infection, a DMSA scan, which is usually done 4 to 6 months after the infection, and a micturating cystourethrogram, an MCUG scan. And what do the guidelines say for a typical UTI and atypical UTI and for recurrent UTI. This is what we will be discussing now. So before we do that, let me just copy this, because the guidelines, sorry, so the guidelines are different for children of age less than 6 months and children of age more than 6 months. So we will be discussing it accordingly. For if this is a child of less than 6 months of age, sorry, this is a child of less than 6 months of age, then an abdominal ultrasound is not required during an infection. However, you need to do an abdominal ultrasound within 6 weeks. If this abdominal ultrasound is abnormal, then you will ask the child, or you will make the child undergo an MCUG scan only if this is abnormal. However, normally you will not do DMSA scan for a child with typical UTI less than 6 months. Okay, this is less than 6 months of age of the child. But if the child has an atypical urinary tract infection, all of these things, then you have to do an abdominal ultrasound during the acute infection. However, you are not required to do an ultrasound within 6 weeks. So the concept is you have already done an ultrasound during infection. There's no need to repeat it. But what you need to repeat is, if it is an atypical UTI in a child of less than 6 months of age, a single episode, you have to do DMSA scan and you have to do MCUG scan. Okay. For recurrent UTI, again, if this child is having recurrent UTI with maybe every time it's a typical UTI, but now he or she has had more than 3 episodes of lower UTI, let's say, and now is the time you have to do an abdominal ultrasound. Concept is the same. You're not supposed to repeat an abdominal ultrasound within 6 weeks if you have already done an ultrasound during the acute phase of infection. Of course, you will do both MCUG and a DMSA scan for evaluating scars and for evaluating vesicoureteral reflux for these children within 4 to 6 months of time. Okay, so this abdominal ultrasound within 6 weeks is only done for a typical UTI which responds to antibiotics. Once everything has resolved, within 6 weeks you'll call this child back again and do an abdominal ultrasound. Otherwise, in all other cases, you will do an abdominal ultrasound during an infection, and then you will do a DMSA scan and MCUG scan for children of less than 6 months. Now, for children of more than 6 months of age, there's no requirement for you to do an abdominal ultrasound during an infection, and there's no requirement for you to do an abdominal ultrasound within 6 weeks if it is a typical UTI and responds well to treatment. No requirement for you to call this child back again to do a DMSA scan, and there's no need for you to do a micturating cystourethrogram. If this child of more than 6 months of age had an atypical UTI similar to a child of less than 6 months of age, you would do an ultrasound during his infection, and therefore you would not require to do an ultrasound within 6 weeks. You would do a DMSA scan. However, you are not required to do an MCUG scan for a child who is more than 6 months of age. For a child with recurrent UTI, there's no requirement for you to do an ultrasound. This is contrary to what we learned for children less than 6 months of age. There's no requirement for you to do an abdominal ultrasound during the infection, meaning that you will have to arrange for an ultrasound within 6 weeks of time. Again, you'll do a DMSA scan in these children also, but you will not do an MCUG scan. So how do you remember? For any child less than 6 months, an MCUG scan is always done if it is an atypical UTI and if it is a recurrent UTI. But if the child is more than 6 months of age, you're not required to do an MCUG scan according to the guidelines. Okay. In terms of DMSA scan, you will do DMSA scan to every child with either atypical UTI or recurrent UTI, regardless of the age. In terms of ultrasound during an infection, if the child has atypical UTI, you will do an ultrasound during acute infection, regardless of the age. However, if the child is less than 6 months and has recurrent UTI, that is the only time when you'll do an ultrasound abdomen during an acute infection. Okay. If the child is more than 6 months, there's no requirement for you to do an ultrasound during the active infection, and regardless of the age, there's no requirement for you to do an ultrasound during an acute infection if it is by a typical organism. There's only one condition where you will do MCUG scan in a typical UTI case, and that is if there is any abnormal result in a 6 weeks follow-up ultrasound in typical UTI patients of less than 6 months. So this is all. It might be confusing, but I've tried to simplify things for you guys. If you need to, please re-watch this video a couple of times so that you get the hang of it. All right. Have a nice day, and see you later.